pleased to be able to present this bill today, the Disabled Facilities Grant Review Bill, and to be able to speak on the subject of the Disabled Facilities Grant. This bill, Mr Speaker, has its origins in discussions in the All-Party Parliamentary Group for Muscular Dystrophy, which looks at the difficulties faced by many people within the region of 60 progressive muscle wasting and muscle weakening conditions. I heard from Muscular Dystrophy campaign that for many people, the costs of adapting a home to meet their needs, including the needs of adults and children and young people, are increasing year on year and can easily exceed the current cap on the Disabled Facilities Grant of £30,000 per year in England, a figure set in 2008. In Wales, the figure is £36,000, while in Northern Ireland, the cap is £25,000. And in Scotland, there is a scheme of assistance similar to the Disabled Facilities Grant. This is not just a question of costs, though. Having the correct adaptations to homes means that people with disabilities, and also many older people living at home, have independence to be able to do the things that we all take for granted in their own home and outside their home. The forward to the 2018 report into accessible homes by the Equalities and Human Rights Commission set out the position very clearly. They said, decent housing is a basic human right that helps people to have independent, fulfilled lives. Everyone should be able to live in an area of their choosing, cook and wash for themselves, avoid falls, make the choice not to live in residential care, go out to see friends and have them over. In essence, they should be able to lead a dignified life as part of a community. This is our vision for all disabled people in Britain who are currently being denied their right to live independently, something many of us take for granted. We know that disabled people are frustrated by the housing system, and with good reason. The numbers speak for themselves. Research from charity Leonard Cheshire shows that 67% of councils report disabled people not having crucial home adaptations completed within the 12-month deadline. 23% of councils report disabled people waiting over 2 years for completion of works. Demand for home adaptations through disabled facilities grants rose by 27% between 2015 and 2019. Last week, Mr Deputy Speaker, the latest English Housing Survey 2018 was published. It reveals that only 9% of homes in England have the 4 key accessibility features to deem them visitable, and even that is an increase from 5% in 2005. And 57% of wheelchair users are living in adapted homes. These figures underline the importance of accessing the Disabled Facilities Grant, given that so many homes are currently inaccessible. Housing Association Habinteg estimates that over 400,000 wheelchair users are living in homes which are neither adapted or accessible. This is simply not good enough. We need an urgent review of the Disabled Facilities Grant in order to make homes truly accessible and to improve people's quality of life. When we think about those words I quoted from the EHRC, we can see how essential it is to improve access and to improve the level of disabled funding grants to meet the needs of individuals. While many disabled facility grants are comparatively modest in size and don't require massive structural change, it's absolutely vital that the cap should not prevent those who need more major changes to access them. Commenting on the English Housing Survey last week, Habinteg Chief Executive Sharon Carter said, whilst it's encouraging to see the proportion of homes with basic accessibility features increasing from 9% to 5%, as it was in 2005, it's clear that the total proportion of homes which are accessible is still woefully inadequate. The current situation is simply not good enough. We need an urgent review of the Disabled Facilities Grant in order to make homes truly accessible and to improve people's quality of life. And of course, we need to be building more homes which are accessible as well, and finding ways to make sure that this actually happens. Last week, I met with Housing Minister Christopher Pincher, together with Kerry Thompson who is a Hangley Teg resident living in an accessible home in Milton Keynes. We met to discuss the proposed and long-delayed government consultation on accessible housing and to highlight the issue of the lack of accessible housing. I was happy that the Minister agreed to meet with us, but it's obvious that much more needs to be done. Kerry, who is a wheelchair user herself, only last week spoke of her experience of living in an accessible home. Living in an accessible home myself, she said, I know firsthand how vital they are for a disabled person like me. Accessible and adapted homes help alleviate pressures on health and social care services and budgets. They enable greater independence at home and speed up hospital discharges. This is crucial at a time when our NHS and social care provision is already under enormous strain. And in this moment, when we're all spending more time at home than ever before, having a home that's fit for purpose is very important indeed. The Department of Health and Social Care recently announced that £505 million will be made available for the DFG in 2020-21. This is the same level of funding as the previous year. This isn't good enough to meet the challenges of adapting our existing housing stock. With an ageing housing stock, higher numbers of people over 65, an increase in working age adults with long-term disabilities, and more families with disabled children, the need for essential home adaptations continues to rise, and therefore so does the need for funding. It doesn't have to be this way, and it shouldn't be this way. So what can we do? Well, this bill calls for a review of how some aspects of the Disabled Facilities Grant operate. In particular, the government should look at reviewing the Disabled Facilities Grant cap every year, using inflation-based indices so that it can accurately and consistently set the cap. Furthermore, a Disabled Facility Grant Registry should be created to enable increased transparency of the number of Disabled Facilities Grant applications and the amount requested. As I started out by saying, the Disabled Facilities Grant cap was last raised in 2008, but the cost of adapting homes has gone up and constrains the adaptations which can be made. We must ensure, Mr Deputy Speaker, that the grant covers proper professional building support that will stand the test of time, and we must recognise that we need to develop and fund the best solutions for individuals. On top of this, the government must review and address the barriers to installing adaptations in the private rented sector. More and more people rent privately, and experience shows that private landlords are often unwilling to allow changes to their properties, even if it's for accessibility purposes. But there's another aspect to this too which we need to look at. As smart technology develops and provides real benefits for people with disabilities, we must look at how we can use the Disabled Facilities Grant to enable housing stock to take advantage of these developments. Smart homes enable older and disabled people to easily operate things around their homes, to stay connected socially and to feel safe and supported, and they enable independence. And recent research shows that cost and poor digital cabling are major barriers for people to access smart home technology. So Disabled Facilities Grant should also, where it's assessed as being helpful, cover the costs of the installation of cabling and other home modifications in order to improve digital connectivity. And of course we need to move to a position where more of the new homes we build are fully accessible. An insight report by Habinteg last year revealed just 1% of homes to be built outside London by 2030 are set to be wheelchair accessible properties. Less than half of all planning authorities have set requirements for new homes to meet higher accessibility standards. We can't continue to kick the can down the road on this issue. That's why we need that consultation on accessible housing that I mentioned. Until we have a real commitment to building that housing, we will continue to rely on the Disabled Facilities Grant to adapt our current inaccessible homes. And we need to adapt the scheme and make it better fit the needs of people, like those with muscular dystrophy, who need those essential adaptations to make their homes fit their needs and provide the independence which they are entitled to expect. Thank you.
I've had no notification that anybody wishes to oppose this bill, so I propose that I put the question that the honourable member have leave to bring in the bill. The question is, that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. Aye. Contrary, no. I think the ayes have it. The ayes have it. Who will prepare?